Good evening, everybody. I'm Ornella Oggiano, and I am an intercultural mediator from the Association Regina Margherita Onlus. In this video, I will try to explain to you the current coronavirus situation by outlining the information provided on the website of the Ministry of Health of the Italian government. So let's start here. What is a coronavirus? Coronaviruses are a large family of viruses known to cause disease, ranging from the common cold to more serious disease, such as a Middle Eastern respiratory syndrome and the severe acute respiratory syndrome. What is the new coronavirus? A new coronavirus is a new strain of coronavirus that has never previously been identified in humans. In particular, one called SARS-CoV-2 has never been identified before being reported in Wuhan, China, in December 2019. What is COVID-19? The disease caused by the new coronaviruses as a name COVID-19, where CO stands for corona, V for virus, D for disease, and 19 indicates the year in which it occurred. The World Health Organization Director General Ghebreyesus announced that the name of disease on February 11, 2020, through a brief with the press during a break in the extraordinary forum dedicated to the virus. What are the symptoms of a person with COVID-19? The most common symptoms are fever, fatigue, and dry cough. Some patients may experience soreness and muscle pain, nasal congestion, runny nose, sore throat, or diarrhea. These symptoms are generally mild and behave gradually. In several cases, the infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. How dangerous is the new virus? Some people become infected but do not develop any symptoms. Generally, the symptoms are mild, especially in children and young adults, and slow in the beginning. About 1 in 5 people with COVID-19 become seriously and have a difficult breathing. How is the new coronavirus transmitted from person to person? The new coronavirus is a respiratory virus that mainly spreads through close contacts with a sick person. The primary way is by respiratory droplets produced by infected people, which can be passed on through the blow methods. Saliva, coughing and sneezing, direct personal contact, hands, for example by touching the mouth, nose or eyes with contaminated, not yet washed hands. What are the rules from hand disinfection washing? Hand washing and disinfection are the key to preventing infection. You should wash your hands often and thoroughly with soap and water for at least 60 seconds. If soap and water are not available, an alcohol-based hand sanitizer, alcohol concentration of at least 60%, can also be used. What can I do to protect myself? So stay informed about the spread of the epidemic available on the World Health Organization website and on the Ministry website, and adopt the following personal protection measures. Wash your hands often. Avoid close contact with people suffering from acute respiratory infections. Avoid hugs and handshakes. Maintaining in essential contacts an interpersonal distance of at least 1 meter. Respiratory hygiene, sneezing and coughing in handkerchief Avoid contact of the hands, avoid contacts on the hands with the respiratory secretion. Avoid the promiscuous use of bottles and glasses, especially during sport activities. Do not touch your eyes, nose and mouth with your hands. Cover your mouth and nose if you sneeze or cough. Do not take antiviral drugs and antibiotics unless they are prescribed by your doctor. Clean the surface with chlorine or alcohol-based disinfectants. Use a mask only if you suspect you are sick or if you are assisting sick people. If you have a fever, cough and breathe difficulty, and suspect you have been in close contact with a person with COVID-19 respiratory disease, stay at home. Do not go to the emergency room or medical offices, but call your family doctor, pediatrician, or medical guard on the phone, or call the regional toll-free number. Use the emergency numbers 112 and 118 only if strictly necessary. What is meant by avoiding any moment of individuals? One must avoid leaving the house. You can go out for work or for health reasons or for other needs, such as, for example, the purchase of essential goods. However, you must be able to prove the reason. This can be done by means of a self-declaration, which can be made on a pre-printed form supplied to the state and the local police forces. The veracity of the self-declaration will be subject to subsequent checks, and the not veracity constitutes a crime. It is advisable to work remotely where possible, or to take holidays or leave. Without a good reason is required the necessary to stay at home for the good of all. There is also an absolute ban on leaving home for those who are quarantined and test positive for the virus. The sanction for those who violate the limitations on travel is the one provided generally by the Article 650 of the Penal Code, and not compliance with an order of an authority, penally provided for arrest of up to 3 months or a fine up to €206. Unless a more serious hypothesis can be configured, such as provided by the Article 452 of the Criminal Code, culpable crimes against public health which pursue all conducts capable of producing a danger to the public health. In order to better manage this current situation, the Einstein Institute of Health recommended you try to stay in touch with your loved ones using Skype or phone. Read and disclose information only from official site, World Health Organization and Einstein Institute of Health and the Ministry of the Interior. Use strategies that have been useful in the past to deal with a difficult or painful situation. If you have children, reassure them with a clear explanation if required. Our psychologist, Angela Marella, reminds us that changes are part of our life and we must accept. And also remember that this is everyone's concern. This is only a temporary situation that is constantly changing. Let's focus on the present without thinking too much about the future, with in mind to focus on our attention to our breathing or our body. Thank you so much for your attention. See you soon.